I'd like to welcome you to the last breakout session today at the Health Literacy Summit, and welcome you to effective and inclusive consumer testing of health resources. I'm going to introduce the speakers to you today. I'm Anna Buer. I work for Wisconsin Literacy as a literacy consultant with our adult and family literacy programs in the northeast part of the state of Wisconsin. So we have with us this afternoon Stephanie Sievers, who is a health insurance literacy lead at Covering Wisconsin. Stephanie leads programs that create materials to help consumers better understand and use their health insurance. She writes plain language curriculum and materials that are accessible to consumers at all literacy levels and provides trainings to organizations on how to use these materials. Stephanie has extensive experience in teaching and curriculum development, including materials to be used with non-native English speakers. She has taught at state universities and at a refugee resettlement organization. Stephanie holds a master's degree in Spanish linguistics and a bachelor's degree in English. Jeni Appleby is a health insurance literacy specialist for Covering Wisconsin. She provides healthcare outreach and support with a focus on coverage through Medicaid and the health insurance marketplace. Jeni works on a team to create and disseminate health insurance literacy on how to sheets and conduct trainings to professionals and consumers.
All right, welcome everybody. Thanks for being here. So we'll kind of go through these first few slides rather quickly, but just to give a little bit of background information before we jump into the consumer testing. So a little bit about Covering Wisconsin. So we are a grant-funded organization. Our home base is UW-Madison. We're out of the School of Human Ecology, but we also have a second office in Milwaukee at Community Advocates. We also do serve more than just Madison and Milwaukee, though, and a lot of that work comes through some programming I'm going to talk about with our Navigator program. But we've been around since 2003. We provide education and assistance to programs that support health. So although health insurance is kind of our main focus area, we do connect with other programs as well. So our Navigator program is where we're actually a Navigator entity, and we provide that direct enrollment assistance. Stephanie and I don't work on that specific program, but a lot of our staff do. So we actually are having consumers come in. They are enrolling primarily in the Affordable Care Act or the Marketplace, or Badger Care Plus, which is our state's Medicaid program. And then we train on health insurance, health literacy, topics such as today. And a big part of what Stephanie and I work on is our health insurance literacy projects. And that's really developing those resources that we're going to talk about in just a moment. When we are creating health resources, what does that look like? We work very collaboratively with community members. I'm probably going to mostly call them consumers, so that's what I mean, though, is the general public, and then also the professionals around the state. We couldn't do this work alone. We develop them for all literacy levels, so a lot of the best practices that I'm sure you've been hearing at the conference, we always implement in our work. And this is kind of the process we go through. So the first thing is really to learn those barriers. Why are we creating these resources? That's where our office really connects between our Navigator work and our health literacy work very closely. So for example, when the Affordable Care Act was rolled out and staff were going to start doing these applications, they started noticing pretty quickly, wow, there is a lot of information in this application that is really overwhelming people. They are being asked to choose a premium. They're being asked to determine if they want silver, gold, platinum, bronze plans, like what do these metal tiers mean? And so those interviews were just informal. Some of them were informal conversations with our own internal staff. They were formally planned out with other partners who are also doing enrollment around the state, and observing too as well to really learn those barriers and hearing from the consumers themselves. Step number 2 in that whole process, so we've identified our barrier, is to really do research on that topic. And so that's where a lot of our work is a lot of background information. What is the policy, the current new policy regarding, for our example, the Affordable Care Act? What resources are being created at the national level, at the state level? We don't want to duplicate things that are already out there. Number 3, we all know this, what's nice to know, what's need to know. Number 4, we always want to design in a way that's very logical and actionable. We don't need to tell everybody all the information we have in our minds. We need to really think out our steps and so people can act on it. And then number 5, which we're going to dive much deeper into, is that consumer testing piece. Everything that we create at our organization that is some sort of handout, whatnot, gets consumer tested, even all of our stuff in Spanish. So we'll do consumer testing in English. We don't just translate it into Spanish and assume it's good to go. We also consumer test it in Spanish. So a big piece of our resources that we create is what we call our how-to sheets. The how-to sheets are free, available to download. They're at coveringwi.org, and Stephanie's going to just pass some of them around the room. These are pulled from our binders. They're laminated. We'll collect them back at the end. But just so you can see what are some of these sheets we're talking about. Here's just a few of them that you can see that we have a series on Medicaid, which is Badger Care Plus. We have a series on the health insurance marketplace, on getting started, signing up for health care, using your health care, financial topics, chronic conditions, resource guides for caregivers. It's really the past handful of years we've really increased our inventory of our how-to sheets. There's over 30 of them now, maybe even higher at this point. And so you'll be able to see some of them if you go to the website and if you just look at the ones that Stephanie's handing out now too, as an example. And then also, in addition to those are kind of our internal ones, we create sheets with partners as well. So maybe a partner says, you know what, I have an idea, I have some funding, we have a need, but we don't have the capability at our organization to create something at this time. We don't have the staff that knows the health literacy best practices. We don't have somebody who has the graphic design skills. So we've partnered with them. So a couple examples here. The first one are county community resource guides. That was a partnership with Anthem. They provided a small grant so that we could do that work. The middle one is a more recent initiative, and that was with the Wisconsin Cancer Council. And then the last one is one that I worked on, and really this started because the Milwaukee Women's Shelter, and it's for survivors of domestic violence and also an emergency shelter for people who are homeless. They are based out of my building at Community Advocates. And so it was a real logical connection where they said, okay, we need to really update our resident information packet, so how can you help us? Again, here with this, we really started by those interviews and learning the barriers, and we can't do that alone in our office. We really rely on our partners to give us that kind of feedback. So those were the how-to sheets, but the how-to sheets aren't the only resources that we work on. When we say the word resources, a lot of them do have to do with those actual sheets, but also we're talking about billboards. Here's a billboard that was in Milwaukee. We're talking about websites. We're talking about brochures, videos, social media posts. Those are all different resources that we're putting out there for people, and all of these benefit from that consumer testing. So real quickly, just in the next couple minutes, what we'd like you to do to kind of warm up, start talking, it's after lunch, is just turn to a partner, or it can be 2 or 3 people, and 2 questions. One is just let each other know, have you ever done consumer testing? Have you ever gotten that feedback from the public? And then 2, think about something at your place of work that could benefit from going through some consumer testing. Could I see, just by a show of hands, how many people have already done some form of consumer testing? Okay. How many people were able to think of something at your place of work that could benefit from some consumer testing?
Everyone's hand should be up.
Okay, great.
One of the things that we just wanted to let you know is something that we've found in our own consumer testing, what consumers respond well to. So we find that instead of giving them a large packet of information, we really just need to give them that information that fits their current question or situation or need at the time. If I give them more, it's just gonna hit the trash. Also, if you circle or write notes on the resource that you're gonna give them, they're more likely to look at it later. Okay, we all know we should use plain language, simple language, but let me tell you a story. I tested once at a men's shelter. I had to use the word HMO to describe something that's in Medicaid here in the state. DHS calls it HMO broker. Choose an HMO. They don't use another word. That's the word they use, and there was insistence. I had to use this word. I consumer tested it. I had it defined. I had a box, a nice box with a picture image to go with it. Two of the gentlemen asked me what it meant, and the other gentleman said, oh, look, there's a definition here. Oh, okay, got it. We turned the page, the word came up again, and they asked me again what it meant. So just, think about simple language throughout or always define it. Next, people prefer to speak with a person when they have a question. They don't want you to give them a website. They're interested in your information, but they want to know who to call. So this is really key. We're trying to teach people about health insurance, which is a super complicated topic, and it involves a lot of numeracy skills, a lot of complicated examples. And even when we gave examples, I've had people with their body language or words be like, oh, I just feel like you're making me do a math problem. This feels like a story problem. And so we've gotten a lot of our examples. If you saw the pregnancy sheet going around, we didn't even put it in a story. We would say family size, a number, income or salary, and then a number. And everyone qualifies so that we don't even have sentences there. It's just a real simple, you can kind of grab the information quickly without having to read it and think of the story problem in your mind. I think this slide, everyone knows this, but and we've even found it in consumer testing, people really want the larger fonts. They want step-by-step instructions. People love when you give them steps with action. They feel like they can really take the content and do something with it. We have found that people really respond to bright colors, which, we've tried to test the same materials in black and white. We don't get such a great response. And people love the literal images and visuals that help them understand that particular topic. So we don't use, we're talking about health insurance. So we're not using photographs that might influence people's emotions, because that's not really going to help them understand health insurance. Unless you want to communicate, it's okay. Don't get frustrated. But other than that, we have not found them to be helpful. I love this phrase, grab and go. I really want to provide information that people can grab and go. They don't have to read the whole sheet to get something. So they can look, see one section, gather a piece of information, and run with it and use it in some meaningful way. And to do that, people really respond to, they want the headings, they want boxes of information, bullets, numbers. They don't want to read. Has anyone had to do some research and find an answer to a question on a government website? Do you want to read to find the answer to your question? I know I don't, and I find it very frustrating when I have to read page after page after page, and I just wish they would have really used some more subheadings so that I could scan and find what I needed a little bit quicker. We do have a graphic designer. We're very lucky in that. But we want you to know that you can improve your resources without one. So here are two examples of styles of resources that you can design in Microsoft Word. So both were done in Word. So the one on the left I did, and the one on the right my graphic designer did in Word. I was like, wow. And it looks almost identical to the sheet we gave him. We said, here, make one in Word using this sheet, the information from this sheet, and he made it look almost identical. I was so impressed. So
that's really the point, is don't be discouraged if you don't have the funding for a graphic designer. These are little tips that you can still implement with your resources. So, okay, you've got some product, you're ready to consumer test it. What does that look like? The first thing is to really think about your intended audience. So where is this going to get rolled out? Is it statewide? Because if it is, then make sure you're testing it statewide, not just where your office is located. So if you're planning to use it in rural, urban, suburban settings, you want a lot of variety of people to also look at it. The second one, is it for the general public or a specific group? So if you are trying to write something for example, we did a sheet, Medicaid Badger Care Plus for pregnant women. Well, we should have women who are pregnant and have Badger Care Plus review that specific sheet, have it relevant to that audience. The third one, we get asked a lot on our website, are these for professionals or are these for consumers? The answer is both. So here's the thing. When we originally kind of started and really kind of ramped up what we were creating, there were some topics that really seemed a little more high level and maybe are going to be the consumers or for the professionals, not just to hand out to consumer. And while we still encourage somebody not just to hand out the sheet but really talk it through and explain it, we understand that separating it out and thinking that you're making something just for professionals, it often is still going to end up in the hands of consumers. The reason being is that might be the one and only resource they have on the topic. And so if they just explained it to someone and they want to give someone a sheet, they're just going to take what they have and give it to the person. We've talked to people who say, they wrote something that looked more like a memo and then they'll show up at some office and it's tacked on the public bulletin board. It's like, wait, that was supposed to be an internal thing. So really the goal is to create things that anybody can use because everybody appreciates simplified information. That goes to the last 2 bullet points on the slides too, is that we've heard over and over again, you cannot tell when somebody has low literacy. And so you don't know the literacy level of the professionals you're working with. You don't know what your colleague's literacy level is. People aren't getting a test on that. And so you have to kind of keep that in mind too. You're really creating things for everybody. And we've heard often, it's not dumbing down. It's that you as the worker are smartening up the way that you can create stuff. And then the last bullet point is that if you give people, the professionals, information that is easy to grasp, they can then better explain it to consumers. You're not putting it on them to go to that website with all the details, think about that, then rephrase it themselves to make it more simplified. You've already put in that work so that they can look at something and easily explain it. Now that we've kind of identified, okay, we have this target audience, we want to start consumer testing, how do we find consumers to test? We could not do this without our partnerships with community agencies. I cannot stress that enough. We, just through our organization being around, we have partnerships throughout the state with different agencies, extension, public health departments, shelters. We'll get to it in a couple slides of just some specific examples of where we have tested. But we really look to those agencies because they have trusted relationships then with their consumers. So we're not going in saying, we want to test your consumers. We're talking to those partners first. We're seeing if it's a good fit. Sometimes it is, sometimes it isn't. The benefit is that, when we're working with those organizations, we then do the focus groups at their location. And so they already may have the consumers showing up for medical appointments, or maybe that's where they get their meal, at the noon hour, or whatever it might be. So it's a comfortable location for the consumer, which helps because they have a way to get there at some time. So hopefully they'll have a way to get there. But also, their comfort level is much higher than if we invited them to our office. And then as far as buy-in, I don't know how to say this except that we don't really have to convince the agencies that it's good for them. We make sure that we're approaching agencies that are going to feel that there's a benefit from this information. We're not going in and saying, your consumers need this information. We're having that conversation and saying, okay, we've already addressed some barriers. So in the example of the sheet for pregnant women receiving Badger Care Plus, we were focus group testing that at a WIC office, Women, Infants, and Children's. And so they felt it was valuable because they wanted to use it once it was completed. And so we're not just creating these ideas out of thin air. We're making sure that where we're partnering will benefit from whatever it is we're creating as well.
I just want to add to that. So we've done a lot of different topics for caregivers. We've done a sheet on detection of cancer, thinking about testing. And when you're reaching out to people, asking if you can interview them to talk about the barriers that their clients find, and you go through a whole interview process, you've listened to them and really validated whatever they had to say and taken great notes. Well, so when you call them back to say, hey, could you help me out with a focus group? Often the answer is yes. So that first step of the interview really helps pave the way to develop that relationship where they will be happy to organize a focus group.
And then the last point is just that it is a mutual relationship. And so we look at what can we also provide for that organization that they would like. And so in some instances, it's been a presentation. And so that same WIC office that I'm referring to, they said, you know what, this would be really helpful to just have a health insurance overview presentation for our staff. So we said, great. What day should we set that up? So we're kind of giving back to them. Also, do we have in the budget where we're able to provide some copies once the sheet is finalized, some color copies, because not everybody has the budget to print and color, things like that. So overcoming some barriers. So there definitely are some challenges just with the logistical pieces of getting the focus group set up, recruiting participants, getting people to sign up, to show up, all that kind of stuff. What we found is that it definitely helps if there is a nice, easy to read flyer. So we've actually taken on this responsibility, so we don't ask our partners to create it, but we'll create the flyer for them. That's simple, easy to understand who, what, details, if they need to sign up, how much they'd earn, all that kind of stuff in one easily packaged flyer. This helps tremendously because then the staff at the organization can refer to it. They don't have to try to search their inbox of that email I sent them for the day and time. They have those flyers. They can make copies for the flyers, give it to the participants to remind them.
It also gives them language to use when people are like, well, what is it for? What is it about? What are we going to do? And then they can just refer to the sheet and have those answers.
And you have an example of one time when we didn't use a flyer, we didn't have created a flyer.
Yeah, nobody showed up. The staff weren't really good at organizing it. They didn't really understand what to say to people. They were unsure how to explain about the incentive, and nobody came. And it was a 4-hour drive from here.
Yeah. And so that just shows that we might have it in our minds, but we have to also make sure we're clearly communicating to our partners, what are we going to do? What is this focus group about? So here's some of the locations we've been to. Basically, I think the list is actually even longer than this, but we wanted to kind of group them so you kind of see the types of places. But you really have to think about your demographic. So who is it that you're creating materials for? For us, these are all places that would benefit from using the materials once they're finalized. So community health centers, free clinics, shelters, WIC offices, local organizations, and then that last bullet point is really thinking about if you have your target audience in mind. And so those are a couple where you've tested before.
Yeah. I interviewed first at Gilda's Club to talk about barriers, thinking about health insurance, what do people need to know who are living with cancer, the Aging and Disability Resource Center, we talked a lot about caregivers, what are the barriers that they have, what questions do they come to the ADRC with, and they are so happy to organize the focus group afterward. And often what is great for us is after we've done it and it was successful, the clients will tell the person who organized it how much they enjoyed it and how much they would like to do it again. And it paves the way for us to have a better partnership with that organization. So the next time we have to test something, it's easy.
Yeah, we've been asked numerous times by the consumers, when are you guys going to come back? So, okay, one big piece was the partnerships, right? Setting them up. Another really big piece is the incentives.
Yeah.
So we are writing into our grants to provide cash incentives to the consumers. And in a lot of ways, they appreciate it. And I think that it really sends the message that their opinions and their time is valuable. And so we're not just trying to, grab somebody in the waiting room and say, tell us what you think. we're telling people we really want to hear from you. We are making this and we want it to be clear for you, for others who might read this. So that goes a long way. The cash incentives go a long way. So we prefer, because we've noticed that our consumers prefer cash. Gift cards also work, but we tend to do cash more often. Here's the amount. There's really no rhyme or reason. This is just kind of the parameters that we set, and we have no trouble getting participants with these prices. So take them or leave them. But one thing I want to kind of point out is that the last bullet point there is that you might have some red tape to go through. Your organization might say, you know what, we cannot just start paying people to give us their opinion. We're not a market research company. That's not going to happen. Can you do a contract with the partner agency? Could you pay that partner agency, and then it's their staff and their time to help get those groups, $200 for a focus group where maybe they're able to connect up with people who are already coming for a program, and then after their dinner program, they're going to stay and do the focus group. So think about it. If you have funds available, can you pay consumers, number one? And if you can't, can you pay the organization?
So I have an example of this that works really well. I have two, actually. So when we wanted to pilot test some information and have people do a pre and a post test, we went through the literacy agencies here in Wisconsin, and we sent out an email through Wisconsin Health Literacy. We're looking to find some groups who will participate in this, and we were paying a $100 cash incentive to the agency. And that's good money sometimes for small literacy agencies, and they can put the money to good use. And it was very helpful for us as well. Another thing is, because we work for the university has a very strict policy. I cannot give a cash incentive to someone who is not a citizen. I'm trying to test sometimes materials in Spanish for low literacy populations, and I have a really hard time finding participants who fit all of those parameters. So here's another case where I can work with another agency who serves that population, and I can pay them, and they can potentially pay the participants. So there are some workarounds.
So this is something we've been very intentional about as we've created resources, is writing into our grants specific line items for incentives. But what about when the incentives aren't available, which happens for a lot of people? So if you don't have incentives available, we still would strongly encourage that you have at least one person from your target audience review the document. Don't just circle it around for everybody in your office, but try to find somebody from your target audience to read the document. If you can't, if your target audience is really specific and nobody knows anybody from that demographic or would feel comfortable asking them, try to at least have somebody who's not working on the project review it. So we have used colleagues who aren't working on our project. Maybe they don't know anything about, the cancer sheets Stephanie has been creating, and they could give some honest feedback. Also, honestly, friends, family members, we've had some really good input from staff members' parents who don't know about these topics, neighbors. So try to at least spend the time to have some sort of outside consumer review your materials. And then the last bullet point is, when we were doing some school-based outreach a number of years ago, we hadn't thought to write in money for incentives, but we were asking parents to come to focus groups. So I wrote to a bunch of Targets and a bunch of Walmarts, and I said, here's who we are, here's what we're doing. Would you be interested in donating some gift cards that we're going to give to the parents? And they did. And so we were able to get it. I think we maybe even got some from a gas station. I don't recall if it was Quick Trip or where it was. But so that's an option too. I mean, that does take some planning in advance, because you're going to have to write out those letters, and probably over half of them are going to not respond. But we definitely got them.
So when we set up a focus group, we generally try to keep that to 5 to 8 participants. Now, depending on the agency, you might want to actually have 10 sign up, because often we have that 1 or 2 or sometimes more don't show up. So once you're familiar with working with a particular group, you kind of get a feel for how that's going to work out. Because if they show up or not depends more on the staff member who's organizing it and how diligent they are at calling people the day before to make sure they're going to come. We have gotten much better results if it's an hour or less. We've done 90-minute focus groups. I had one stretched to 2 hours. It's less viable. I just, 60 minutes or less, people are tired after that and you're not going to get good feedback. A benefit of a focus group is you get a variety of perspectives at a time. And so maybe you've worded something in a way that people in the community just are not responding to. And if you're asking them, well, how would you say it? One person on the spot may not be able to come up with it, but then when people talk together, that gets exciting. I'll say the best example I have of that is when I consumer test documents in Spanish. I try to always get people from different language varieties. So maybe someone from Mexico, someone from Puerto Rico, someone from Colombia, you know, thinking about who is in your community, get representatives. And it's so fun when people are arguing about how to say a particular word and they speak the same language, but they're from different countries. So, but the same thing happens here. If you know much about language variety, I mean, even in our own country, we all talk so differently based on where we're from. Soda or pop? Coke. It's fun, and that's where it gets rich. That's when you know your focus group is super successful, is that they are giving you the answers you need, and you're gonna be able to take that and put it into your document, and people from that community are gonna really respond. Also, you might have some people who may not feel comfortable in that situation, and a group environment can make it feel like it's less focus on just me if I'm rather shy or timid, and then maybe after 30 minutes, I finally am ready to talk. We recommend that you have someone else take notes. You cannot lead and be responsive to people if you're also trying to take notes. So if you don't have someone to take notes, you can use a voice recorder, but people might find different people respond to voice recorders differently. So we always try to have a human being. And Jeni can talk more about some of her experiences, but some people don't respond well to a computer. You might want to take hand notes. And you also want to record not just what people say, but their expressions, their nonverbal communication is just as important, if not more, than what they actually voice. I can talk more about it, but one day I tested something and I loved it. It was with an 18-year-old, and she was the youngest person in the room, and when she flipped over the sheet, she actually physically went back and her eyes got big, like, whoa, that's overwhelming. So for me, I was like, oh, I failed. That's it. I know I failed. That one person told me all I need to know. Other times, a one-on-one feedback might be more beneficial. So in one-on-one feedback, you don't need as much time. 30 minutes or less is generally perfectly appropriate. It's good if you need some quick, focused feedback. We use it a lot when we want to test an image or a particular wording, or maybe I want to test a document before I get to the focus group so that my focus group can be more rich. Because if I have a lot of problems on that document and we can't even get through like 10 of them, then I'm not going to address everything and may not even know that I haven't addressed everything. So I really like to do a one-on-one beforehand. Also, I've done one-on-one when the topic is complicated or maybe it might be emotionally difficult for people. So I'll give an example. I did a lung cancer prevention sheet. And you know, the first option there to prevent lung cancer is what? Quit smoking. Now, I don't know how many of you might be former smokers, but how receptive are people to that advice if you're a smoker? And how many times have you already heard it, right? And so I wanted to get past that. I was a smoker at one point in my life, so I know, you know, yeah, I know, just I don't need to hear it. So luckily the funder for that project put me in touch with a local research group, and they had some really great advice for if you're not ready to quit yet. And so I was able to include that on the sheet, and I just wanted to make sure, am I am I striking the right tone? Because if I don't have the right tone, even in my focus group, it's not going to go well, and my sheet might be a total disaster. So I happen to have a friend who's a non-native English speaker and didn't complete high school in his country of origin and is a smoker. And we sat down and tested the sheet, and it was great. I got some really, really great feedback, one-on-one feedback, and I have to say that I asked him 3 weeks later, I said, oh, here's that one resource you were curious about. And he was so excited to tell me that he had been smoke-free for 3 weeks. And I thought, my sheet was successful.
It was motivating.
It was motivating. Anyway, I will say that what motivated him is that he has kids. And we talked about it, about, oh, he has young kids, and he smoked like almost enough years to actually do the lung cancer screening, and wow, that's kind of scary. And you know, from the plenary this morning, you know, when you have children, you have someone to live for. It's to protect your family. That was what motivated him.
So another thing with one-on-one feedback is that sometimes some of the materials are a little simpler. Maybe there's just not as much content on them. That's kind of a good time to do one-on-one feedback, because if you're going to do a big focus group and you really just have a few questions, you might not want to spend the time or energy to gather all those people, and money, quite honestly. So here's an example. We were working with a group out of Milwaukee. The Milwaukee Healthcare Partnership is a big partner of ours. One of our staff members convenes the MCEN, the Milwaukee Enrollment Network. And they said, you know what, during this non-open enrollment time, we want people to know you can sign up for Badger Care Plus, our Medicaid program, at any time. And so they wanted to do this whole series of, in different areas. One's going to say pregnancy's covered. One's going to say help to quit smoking is covered. One's going to say mental health is covered. So they're going to go all around the city, and depending on the organization, wherever it makes sense, they'll hang the pregnancy one if, you know, it's at a clinic that serves people who are pregnant. So I was consumer testing this one-on-one feedback, and one of the first questions when I presented this flyer was, what do you think this flyer is about? And the first...
I'm curious. What do you think the flyer's about if you weren't looking at the words?
Yep.
Yeah.
So somebody said it over there, and that was the first answer I got was abortion. And I said, why did you think that? And they said, the way the baby looks. So we said, okay, that's not what this flyer's about. This flyer, that was not the intention. And that was something that we really learned, is that we need to hear those things, because that wasn't our message. So we immediately edited it and we made it look like this instead. So we were still using an image, but we just chose to do a silhouette of the body instead. Another example was that after we had gone over some information, the original flyer had said, many adults, children, and pregnant women in Wisconsin have Badger Care Plus health insurance. The point there was trying to be made that a lot of people have it, a lot of people are eligible. Yes, it's income-based. We're not getting into that on this flyer, just a lot of people have it. So after we kind of reviewed that, actually, and then I would ask, so who might be able to get Badger Care Plus? And from this statement and from their preconceived idea of maybe what Medicaid is in our state,
Or used to be,
even after reading it, a lot of people didn't think men can have it. So even though on the original one, adults in our minds was kind of encompassing men and women, people weren't thinking that. And so we specifically changed it to affordable health insurance for men, women, and children in Wisconsin. We realized, well, we don't really need to say pregnant women because that's women. And so that's kind of the example of consumer testing, of where, you know, we think it might be clear, but your feedback might show differently.
So to talk a little bit about Spanish in particular, since I've had such a hard time sometimes scheduling consumer testing in Spanish, what I've done is I found groups who work really well together, and I just call the same people each time. So they know what to expect. They arrive ready with their pencils. They're there to read it and tell me if it makes sense, if they think All people who are from their country would understand. I mean, they are just ready to go, and it is way more productive. I mean, at times we've done 2 sheets in an hour, and I'm always impressed. And so it's really not a bad idea if you have different topics to go ahead and use the same people to consumer test, especially if you have a target audience who are harder to find. You've already established your rapport with them, so you don't have to reestablish it. So that is worth a lot. It saves you a lot of time, and people are more open of sharing their opinion. Talking about, well, what do you ask people? I would say, well, that depends on your resource. What are you testing, and who are you testing it with, and what are your goals? Always reconsider your goals. You might have written some great questions. Always go back and think, wait a minute, what was our goal in this? What do we want people to do or to know? And so always keep that clear in your mind when you're writing your questions. We ask a lot of questions that relate to design, layout, language, and just overall usefulness of the document. We're very concerned with flow. If people, when they look at it, they know where to look. If when they look at it, they know what it's about, and also what can they do with the information. That for me, that's the number one. Great, I just read something, but what do I do with it? I need to know exactly what I can do. I need to be able to act on the information. So design your questions, thinking of those things. And remember, during that focus group, there are no right or wrong answers. And Jeni and I were talking about it earlier, and sometimes we have to really leave our ego at the door, right? I spent a lot of time sometimes on some content. I think it's beautiful. The layout's gorgeous. It's fantastic. I get to that focus group and it fails. And I have to smile and really be receptive and thankful to people for giving me their opinion. We try to avoid yes or no questions. They're just really, really not helpful. And people will nod and smile a lot until you really start digging and asking questions. Something else we've done is, especially when we have them read over to look at the language, we give them the option of circling words, because not everyone will participate to say the words that are not effective for them or didn't make sense. So that's really helpful, especially when you have more timid people. Have them circle it and collect them at the end. I will also say that when you collect those documents at the end, some people don't want to give them up, which is a good sign, right? Oh, wait, maybe I was onto something. I'm getting it right. They want that information. We have an activity that we're going to do in a few minutes here, but here's some sample questions that we sometimes use, and we don't use them all for each one. It depends on what we're testing. And just to let you know, maybe this will give you a leg up before you test something or when you're designing something. Some things that we have heard that have been helpful for us. Red draws my attention. So whenever we have a warning or something really important to tell people, we try to put it in a reddish tone. We don't go brick red or anything. A lot of people say that boxes catch their attention. They really like the sidebar boxes. We get a lot of people who say they want a phone number, but some people would like a web address too. And so we try to accommodate both audiences. We've heard both that income information is really important. Again, health insurance, health benefits, income information is important. But I will say, if it's too complicated, if, for example, applying for a Medicaid long-term care program, the benefit, the income level, you have spend down options, there's all these complicated pieces, don't put any income information on the sheet. I tested once and it did not go well. People said, no, just don't tell people that, let them call and talk to someone because it's just too complicated. And again, what we heard this morning, I care if it's about my kids. The most important thing, if you're going to consumer test something, is to create a welcoming environment. And if you fail to do that, your focus group will not be very productive. And we've had some failures in the beginning. and it was rough. I would say the number one thing is to be yourself. If you are not sincere and real, you're not going to get sincerity and realness from other people. Some of the things we do, we try not to be too formal. We try not to come as representatives of anything. We're just, hey, I'm creating some content and I really, really could use your opinion and your voice. Some people might be shy. You might need to call on them and make them feel welcome and that their voice matters. I'm gonna say redirect when conversation is getting off topic, but we were talking about it earlier, and we don't redirect in the first 30 minutes. We let people talk and we validate them, because if people see that you're validating one person and their opinion matters, they're gonna be more likely to tell their opinion and give you more honest feedback. So when we start getting halfway through, we redirect a lot more. I've had a lot of great response if I identify my relationship with the topic, if I have one. So as I said, I'm a former smoker. I did a focus group in an African American community in Milwaukee at a community health center, and halfway through the topic came up and they asked me, I made a comment, and they were like, "What? You smoked?" And I said, "Yes, I'm a former smoker. I quit." "Oh, tell us your quit story." So I told my story, and then the last 20 or 25 minutes was so much more productive than the first 30 minutes. It was amazing. So don't be afraid to identify. I'm also a caregiver, so when I test caregiver resources, I identify that I'm a caregiver, and I might say something. My mom has Alzheimer's, so I might say, this is my situation, and then when I'm talking to other caregivers, they're more likely to share their real story and their real opinion than if I'm just some person from an organization testing a document. We really, really try to show people that we value their opinion and their time, and so part of what we do is give them the incentive, but also really end on time. If you say this is going to be 30 minutes, it's 30 minutes. Always thank them for their input.
And in the interest of ending on time,
Yeah.
I think what we were going to kind of role play, but what we'd rather do is spend the time on the rest of this presentation, but we'd be happy to stick around if people have questions about the questions themselves. We're happy to answer those instead of kind of trying them out. So one of the things that we wanted to share with you, though, is that it's not always the smoothest thing when we do when we do the focus groups. Like, there's hiccups along the way, and so some of the challenges that we've had. Number one is letting too many people come to a focus group, and so sometimes what happens, especially if you're at a location and there's something else going on, and then people see that there's a cash incentive, and they'll say, "Can we come? Can we join?" And we'll add a couple more. When it gets too big, you're just going to have people who end up really not participating, and so you don't want to let it get too big. The second thing is we've already talked about not creating that advertising for the agency, because then they might have a hard time explaining it. The third one I want to kind of address, children, allowing children. So this is really a judgment call on your part. If you're going to a school and you're trying to reach parents and it's after school, and they're school age, and you think the kids are going to do okay sitting at a table or reading or coloring, or they have a screen or something like that, and you want to allow it, you can try it. We've had some challenges when we've allowed toddlers in the room because it's a distraction, and
Toddlers don't sit still.
Yeah, and they're not. It's not their fault. They're not wanting to come and sit down for an hour or whatnot. We have made some exceptions when logistically we can't work it out to offer childcare. So a lot of times if childcare is going to be offered, that's something that the agency is able to provide, and then they'll do that. But that's also an offer. People might, if they don't know that person at the agency, maybe they don't want to leave their kids with that person for the next hour. So it's an offer, but it doesn't mean everybody's going to accept that offer. The other thing is, with babies, so when we were working on that packet at the Women's Center, it was really long. So we had 5 different focus groups that we had done because we were only testing certain pieces at a time. There was no way we could have asked somebody to come in and do a whole packet in one focus group. And because we were breaking them up, we were there frequently. Well, at the shelter, people live at the shelter, and a lot of them who were coming to our groups had young children. So out of the 5, 2 times staff were able and available during the day to watch the kids, but on those other occasions they weren't. And so sometimes we did have the young babies in the room because nobody was at school yet. But it can be a distraction, and so just understand that they may end up leaving the room if the baby starts fussing or whatnot. I actually had an example happen of Stephanie and I were at the women's shelter. Stephanie was leading, and so there was a young baby. He was not quite a year, and he was, smiley and happy, but taking his mom's attention, and she was a really active participant too. And so halfway through, I had said to her, would you like me to hold him for a while? I'm happy to hold him. And she's like, yep, sure. So I'm holding the baby, and all of a sudden I feel something wet and warm running down my arm, and the diaper was leaking all over me. So it was a distraction for me and the mom and the baby after that. And that's just kind of the reality if kids are going to come in the room. But
luckily, she's a mom. So.
Yeah, so I was like, it's okay, don't worry about it. But anyway, it's just a point to be made that it's something you have to consider in advance. Married couples, a lot of times we found that one person will dominate in that relationship. It doesn't mean that's reflective of the relationship, but it just happens to be that person is kind of speaking on behalf of our family. Mm-hmm. And so, it's your choice if you want to allow that or not. And then I'll let Stephanie kind of talk about the last one.
Yeah, so I've actually, I listened to another presentation earlier, and someone said that sometimes it's really hard to enter another community, for example, minority community. And we've actually had more problems entering rural Wisconsin because they perceive us as being the liberals. Where are you from? Oh, we work at the university. Oh, yeah, the city liberals. You're from the capital. It has been actually the most challenging group sometimes. Some mistakes we've made. So because we're part of the university, we have access to fleet vehicles, and if it's full, I can use a fleet vehicle from the capital, city government, state government, and I've showed up with one of the cars, and people came in and saw that car in the parking lot, and you're from the government. Well, not really. We work for this nonprofit. We're grant funded, and it doesn't matter at that point. They saw the government plate, so that was a mistake that we made. One of our first focus groups, the Affordable Care Act, had just passed, and there was a lot of hot opinions on both sides, and a lot of people were angry about it. And we did a focus group that was just to get people's opinions. It wasn't even on a resource. It was just to understand how people thought about healthcare and health insurance. And wow, people were so angry that we couldn't even really get to some of the questions that we had hoped to cover. And they perceived us as being on the other side of their political divide. So that even though we're nonpartisan, our organization's nonpartisan, and none of our questions were partisan, it was the perception.
So just real quickly regarding paperwork, just check with your agency. You might have consent forms you need. You'd have to think about in advance if you're going to be taking photos, if you'll need releases, and just letting your partner agency know exactly what paperwork you're going to collect so that they expect that too.
If people have to be a citizen, that's my biggest barrier. So for interpreting the results, when do you need to redesign? Sometimes we have to just reword and we don't have to make a lot of changes, but sometimes we have to redesign the document. We often ask people, where does your I go first? Where does it go second? Where does it go third? I will say you have to explain that sometimes, because sometimes people will scan it to find a word they know, and they'll go to that word and tell you that's what they saw first. So even when you ask that, you have to explain that concept of, things grab our attention, they catch our eye. It may be a word, it may be an image, it might be a color. So always explain that concept first. But if something drew their eye and it's not your main focus, you need to redesign. Maybe people misinterpreted your content or your images. It's time to redesign. Oh, and if they do, ask them what images. They're the best source of information for you. What images would you use? Maybe no one looked at the heading. We get this a lot. and the flow wasn't clear. They didn't know where to look, where to go, and maybe it made them feel stressed or overwhelmed. Oh my gosh, it's like a word problem, or wow, that's really overwhelming. That's too much, and we're out of time. So we are happy to answer any questions if you want to come up. I'll just show you one redesign example of, we had too many steps. It was overwhelming. And so we got down to 4 steps by combining a few things that seemed to make logical sense when I retested it. So, thank you.